A patient is taking phenytoin, develops fever, rashes, and blister on skin. What is the nurse priority action? Administer antihistamine, hold the medication and notify healthcare provider, apply topical corticosteroid, and reassurance the patient. So, according to what is the correct answer? So, correct answer is the B, hold the medication and notify the healthcare provider because it can lead to patient having suspect Stevens-Jones syndrome. That is very important. A patient with epilepsy has been taking oral phenytoin 100 mg. The nurse reviewed the lab reports and assessment finding below. Which finding require the most immediate nursing action? Serum phenytoin level, that is 22 mics per ml, gingival swelling and bleeding, serum albumin 2.5 gram per deciliter, mild dizziness with standing. So, what is the correct answer? So, correct answer is C, serum albumin 2.5 gram per deciliter. Phenytoin is highly protein bound drug, so low albumin equal to more free active phenytoin. So, even if total phenytoin look normal, so this patient is high at risk for Phenytoin toxicity. It include nystagmus, ataxia, cirrhosis, peas, or seizure worsening. The nurse must anticipate toxicity and notify the healthcare immediately. And other options, they are less priority to the albumin, so as level of 22 mics, gingival hyperplasia, and mild dizziness. That is common, not the priority. So NCLEX Phenytoin traps, that is very important for the NCLEX exam. Therapeutic range, that is 10 to 20 mics per ml. Low albumin increase the risk of toxicity at even their normal levels. And cardiac monitoring should be done when patient is receiving IV phenytoin. An oral dose of phenytoin should be given at same time daily and avoid alcohol. The nurse is administering phenytoin to a patient, which assessment finding requires the nurse to stop the infusion immediately. Blood pressure 88 by 50 mmHg, gingival swelling, phenytoin level 14 mics per ml, and mild nausea. So mild nausea, that is the nose, the cause to stop immediately. So correct answer is A. So IV phenytoin can cause severe hypotension and it can lead to cardiac arrest. Which patient statement indicate a need for further teaching about phenytoin? I will see my dentist regularly. I will stop the drug once my seizures stop. I will take the drug at the same time daily. Yes, I will report unsteady walking. So correct answer is B. Never stop phenytoin abruptly. It can lead to rebound seizures. So next question is, a nurse is monitoring a patient receiving phenytoin, which finding indicate early toxicity? Gingival hyperplasia, ataxia, hirsutism, Cora's facial fissure. Correct answer is B, ataxia. So early toxicity signs include first is nystagmus, then ataxia, and after that patient will have slurred speech. So now we will discuss an important point that is very important for NCLEX as the Stevens-Johnson syndrome. So what is this? This is related to aptoin toxicity. So Stevens-Jones syndrome is a rare, life-threatening hypersensitivity reaction, most often triggered by medication that cause the widespread skin and mucous membrane necrosis, leading to painful blisters, skin sloughing, and systemic complications. As you can see in the picture, there is a severe reaction of this medication. So patient is having rashes, fever, as we have discussed in the first starting question. And this drug is extremely important for the NCLEX exam, and questions from this area are asked again and again. So if you are preparing for NCLEX, don't skip this video and make sure you save this video. This is very important. And don't forget to subscribe my channel Manpreet RN Talks for this type of another video. So and crack your exam in first attempt. Thank you.